well, even though we're all within our homes, I would like to acknowledge that we are on Treaty 1 territory, which is the traditional gathering place of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and also the traditional homeland of the Métis people. And that every time we acknowledge this land and this truth, we have an invitation and an opportunity to reflect on what we do and what we can do to make Manitoba a better place for everyone who lives here. So I would like to thank all of you for taking the time to be here today. Before we get into the kind of the presentation part of the town hall, I really want this to be more of a conversation than anything. So I do have a few updates. I've got some pandemic updates for you, and then I'll be sharing some more information about the designation change, which was initially shared via memo a couple weeks ago, and then really want to open it up for questions and discussions. So if you're not familiar with the Zoom platform, you'll see along your bottom of your screen or your phone, you have a mute button and you have a stop video button. So if you could remain muted if you're not talking, just so we can reduce echo and feedback. But if you have a question or a comment, feel free to unmute yourself and speak up. Alternatively, if you look along the bottom and you see the reactions button, if you click on that, you'll see a little raise hand option. And so if you want to just raise your hand if you have a question or a comment, you can do that as well. Or the chat button. If you press the chat button along the bottom, you'll see, perfect. So Connie has shared that she can watch and listen, but cannot use the video or the mic. So she'll type in her questions in the chat. So everyone's welcome to do that as well. Jen Rodriguez here to provide some support for the Q&A section. So if I don't get to your question right away, she's keeping track and we'll make sure to get to them at the end. Okay, so with that kind of boring housekeeping stuff in mind, we'll get started. Okay, so we are one day into the public health mandate changes. So I think everyone knows that effective yesterday, masks were no longer required in public places, although still continue to be recommended, along with some other public health orders like vaccination was no longer required effective March 1st, and that self-isolation with a positive COVID result is continues to be strongly recommended, but is no longer a public health order. So in the sense that it's not being tracked and enforced by anyone. So I know lots of questions about this because, what does that mean for health and transition services? So nothing has really changed inside HTS in terms of the requirement for masks. We still have our organizational policy that requires all staff to be fully vaccinated. So we do, obviously all of our staff are following that. And we do still have some guidelines in place around visitation and checking vaccine status, as well as PPE required for visitors. So I'm hoping or thinking that this helps put minds at ease a little bit. So we don't follow the general public guidelines. We follow what's recommended from the shared health and kind of regional level in relation to infection prevention and control. And as an organization as well, although we are required to do the minimum, we are able to do more than the minimum if we feel that's in the best interest of our staff and people supported. So I'll just take a pause there and just ask if there's any questions about the public health orders and kind of how things are happening in HTS. Okay, so not seeing anything immediate, but again, if you think of something, pop your hand up or just pop it in the chat and can get to it afterwards. So although there's no significant change in relation to those public health orders, there are a few things we are excited about. And so although we're still requiring masks and distancing and vaccines, we are able to restart some of the services and programs that were put on hold for a really long time. And so, although not fully realized yet, a few changes that are happening now and will be happening very soon include things like reopening our pool for people supported in HTS only, reopening our Fit Zone or our little gym for staff in HTS. I know that's something that's very valuable for them. More ability and freedom for the people we support to go out. So things like, going to Jets games, engaging in leisure and recreation outside of the facility. More opportunities for in-person meetings, although we do still look at virtual options when it's convenient and accessible for people. We've seen some ability to increase group sizes within our facility, and also the ability for folks that are supported on different floors or in different areas to be in the same group with the appropriate distancing. So there's more opportunity there for group activity and shared meal times in a safe way. We're welcoming back, some of our important connections with members of our volunteer services team. We're restarting music therapy, in-house dental services. We're right on the cusp of being able to reopen that, and resuming some hairdresser services. So those are just a few things that we can all look forward to, and the people we support can look forward to over the coming few weeks. Okay. So if you remember, earlier in the pandemic, we did a lot of work to make sure that the people supported in the HTS section of 440 River Road were as safe as possible. And that included kind of separating that section of 440 from the other spaces. And so we do continue to do that. And we continue to discourage staff who don't need to be in the HTS section of 440 River Road from coming in. And that's really to make sure that the people supported in HTS who are vulnerable and for some can't be vaccinated, that they remain as safe as possible, but that also all the other services St. Amant provides can continue, even if there were, say, an outbreak of COVID-19 within HTS. So we're going to continue with that for now and kind of consistently reevaluate. We will continue to take direction from Shared Health and the WRHA as it pertains to kind of that reopening plan, or hopefully not, but if there had to be restrictions put back into place if we see an increase in COVID activity in the community. I do want to just take a minute and share some of the takeaways from the pandemic so far. It's become apparent that we're a pretty nimble organization and that we can adjust to meet the needs of the people we support. And so we were really glad that we were able to separate HNTS from our community programs. And like I said, so we can make sure programming continued and that all of your family members were as safe as possible. We also learned and saw that, we're really creative, and the staff that are supporting your loved ones, super creative. So lots of new ways to connect were discovered, both with you, with friends, with activities out in the community. We saw a really great uptake in our technology use, and now we can continue that. So we know how to keep people connected virtually if and when it's needed. We also learned that although in person is a lot of fun, some of the online activities make things so much more accessible for more people. So, we want to make sure there is in-person connection, but we're going to continue to see some virtual offerings as well, especially through our volunteer services team. They saw really, really high attendance for the activities that they were offering. And I know the people supported had a lot of fun. I think one of the most fun activities was the ice cream in a bag making, and that was a lot of fun for everyone. And, I think perhaps most importantly, what we've learned is our staff are incredibly resilient. And although there were moments where we did face some staffing challenges, by and large, our staff showed up, and we didn't experience the level of staffing crisis that other places did. And, we are really so proud of the staff's dedication and incredible work. And we're so grateful for their bravery and for their support over the past 2 years. It's not been easy, as all of you know. And so we're just so thankful that our staff were there and were there committed to your loved ones. So now that the pandemic is giving us a bit of a breather, we have some time to focus on our strategic projects. And one of these projects, and for HTS, one of the most important projects is the service revision work. And so this takes us into kind of the designation change and how that applies to our service revision work. So just as our organization was working through the Omicron wave of the pandemic, we got word from the government that the legislation changes went through, which means that Health and Transition Services is no longer a developmental center in Manitoba legislation, and it's officially a healthcare center or healthcare facility, and that's under the Health Services Act legislation. So, is this a big deal? Yes and no. So HNTS has been operating like a healthcare facility for quite a few years now. And, the start of that was really looking at the admission and discharge policies and really having a committed approach to clear discharge planning for new admissions. So for those who were coming in kind of more recently. One of the key changes that comes with this legislation change is that families no longer need to go to court to admit someone into the service. We see this as a really positive change because we know that this is a difficult process, and it's also a cost prohibitive for some, and so we're really thankful that no longer needs to happen when someone can benefit from our services. So what does this change for us? Does this change our transition plans? No, not really. So we've been actively working with all the people we support, both short-term and long-term, to start talking about moving into the community. With that in mind, though, we know that the pace of available housing and supports is slow. And also given Manitoba Developmental Center's plan to close and complete that plan over the next couple of years, we do anticipate that housing options will likely be prioritized for those residents first. However, it is our job and it is our commitment to advocate for people to be supported in the least restrictive way. And we also know that we and the government as well could face a human rights complaint if someone is ready to move and has an unreasonably long wait. So really our service revision work, we're gonna focus on organizing our staffing structure to support the short-term admissions we're seeing. We're going to continue focusing on the transition out for all people supported in HTS. And we're also going to continue focusing on program development to continue to meet needs identified in our community. And that piece is really where we need to focus and have some consultation with the community and with our funders. So that's really where I wanted to leave it for today. I wanted to leave plenty of time for questions and conversation. This is one of those changes that has been in the works for a really long time. So I had to check with Jen because I feel like the official kind of submission for this change to happen was made about 10 years ago. And Jen remembers it being talked about even before then. So this has been a long time coming, and it's the formal recognition of the work that we're already doing. So that's kind of that, is it a big deal? It is and it isn't. So does it change anything drastically? Not really in terms of our planning and our work, but there are some kind of key positives there, no longer needing a court order to receive services, as well as the fact that we're now a health facility has actually opened some doors for people to access resources they couldn't before, and specifically resources attached to mobility devices like wheelchairs and joysticks. Those were not available when we were considered like a forever home or a developmental center, and they're now available to folks. So that's a really positive change. Okay, so I'll leave it there, and I'm open for questions, conversation, discussion. Oh, thanks, Connie. Thanks for those kind words. Okay.
I did have a question. I mean, it might not even make any sense, but pardon.
No, that's
So,
okay.
oh, I understand. So do all health and transition clients or reside at I put 440 River Road, or does that include some in the community residential program?
So this is just strictly speaking to health and transition services. So just the people supported in the facility in 440 River Road.
How many art clients are there? Like, I know my son is one of them. I just have no idea, right?
Yeah, it's a good question. So the number of people we support, we sometimes use the word census to describe that. So if you hear that word, that's what that means. Right now we have 92 individuals supported in HTS. And that it kind of goes up and down. So as people leave and new people come, so we've hovered around that 95 mark for probably the last year and a half to 2 years. When I first joined the organization in 2019 in September, I believe we were sitting at around 107 people supported. So we have seen a decrease. Yeah.
Okay.
Okay. So if nobody here has any immediate questions, oh, here we go. Okay, you put that in the chat too, Tracy. Thanks for that.
Yeah, sorry. Yeah,
no, that's okay.
So are you looking at transitioning them, like closing that service down altogether?
Yeah, that's a good question. So the advantage or the rationale behind us starting to behave like a healthcare facility years ago was really to make sure that people with disabilities have opportunity to live a full inclusive life in the community, which really aligns with what people with disabilities have been advocating for years. And also so we could be very strategic about the future of our service. And so we know that there are other unmet needs out there. And that's really where that consultation piece comes in. So we want to use the resources we have and the space we have to meet unmet needs out in the community. What exactly that looks like, we don't have all those answers yet. But we talk about opportunities like, could we offer more respite? Could we increase the number of children we support on a short-term basis? We know there's going to be an ongoing need for stabilization. And so, we're currently undergoing a almost $4 million renovation to that area so that we can continue to provide that specialized support. Certainly it's a type of support that isn't offered really anywhere else in Manitoba. And often for folks needing that type of support, their options are a visit to an emergency room or an acute care admission, which we know doesn't meet those needs. So we know that stabilization will continue. We also know that our support for children will continue. So we have a really good relationship with Children's Hospital, and we want to support kids that need kind of a specialized level of care, but not hospital level of care. So almost like that bridge between hospital and home. So we see ourselves really, supporting families and caregivers to learn their child's needs, and especially if there are medical needs, giving families time to get, equipment, renovations, other things in place before their child can come home. We also know there's a need for dementia and end-of-life care for people with disabilities. And so that is something that we do offer and that we've successfully done a few times, both for children, well, not dementia care for children, but end-of-life care for children, and kind of aging and end-of-life care for adults with disabilities. So we know that there is a need a need there as well.
Okay.
Yeah, so there's stuff we know and stuff yet to be discovered, but we have a lot to offer. And I think the other advantage to no longer being a developmental center is that, you know, MDC now officially is the last remaining developmental center in Manitoba, possibly even in Canada, and that we know that they're closing. And so, you know, we see that kind of trend of closures of those types of facilities, and we know that we can offer lots of support and care for people within the disability community in a way that's different than a developmental model of care. That was a great question. So while you guys kind of ponder and digest kind of what we've said, I did get some questions in advance from several families, and so I might just go through these questions. Some of them might be questions you have as well, so maybe I'll go through these, and then if you have anything you want to add or a follow-up question, like, feel free to speak up. So the first question, and I think I already alluded to this, but when was this proposal put forward to change the status? And to the best of my digging and question asking, it looks at about 10 years ago, so around the 2013-ish mark, and that was right around that same time where transition work got underway. The timeline for the change. So the change came into effect on January 1st. And when I say change, I mean the legislation change. In terms of the ongoing transition of folks into the community, we know that's going to take some time. And the pace of that isn't always under our control. And we know that there's still going to be some time to figure out, okay, well, what comes behind that? So like I just kind of talked about, so what services and programs do we want to put in place as more and more people leave the facility? What is the advantage or disadvantage for St. Amant? And what is the advantage or disadvantage for the residents? So that's a really good question. So we talked a little bit about, you know, the advantage of not having to secure a court order in order to be admitted to the facility. I think that's a big advantage. We've talked about a little bit about kind of the opportunity to access more resources now that we're a health facility, and specifically those mobility resources. We know that the disability community has been advocating for community inclusion for a long time, for more than a decade. And so that's another advantage is, you know, we're going to be able to give more people opportunity to experience the quality of life that living in the community brings. When we talk about advantage for St. Amant, again, I think I alluded a little bit to it. So we can now, we have a say in the future of this part of our organization. So we know we have great resources and skill, and we know that we can be innovative and we can meet unmet needs. And if we hung on to that developmental center legislation, that kind of was a bit of a prohibiting factor to really kind of exploring that and fulfilling that. So a really big advantage for St. Amant. And certainly, you know, we want to help as many people as we can. And so that's another advantage too, if we can have people moving in and out of the facility and not living here forever. That enables us to serve more people. Presently, a resident gets funding from the province to go into their account. Will this change? So I believe this is referring to EIA, and that will not change. So nothing changes there. And we do see most of the people or adults we support have full accounts from their EIA payments. So no change there. Will staffing levels change one way or another? So again, this is something that as we evolve our model of care, as people leave and, you know, services kind of follow behind, we do need to think about, okay, so we need to have the right number of people or staff with the right skill set in the right places. And so Will staffing levels change? They might, but it's really going to be tied to, well, what type of service are we providing? So we know that stabilization service, for example, is very different than end of life care and requires different levels of resources and different types of resources. So it's not as easy of saying yes or no. Staffing levels will change. It's a work in progress, and we kind of need to evolve that as our services evolve. Will residents who reside at St. Amant stay at St. Amant? Again, I think I spoke to this. So we're a healthcare facility. We're not operating as a developmental center, meaning this is not HTS is not a forever home. So, you know, there are active plans, and those plans will continue to support people to transition into the community. You know, I want to reassure everyone that those plans are always person-centered and involve an individual's support network, whatever that might be. Really, our goal is to have a smooth transition for each individual that involves some choice, but that also happens in a way that's timely and doesn't take, you know, 5 or 7 years for someone to experience life in the community. Will there still be a board of directors? Yes. So that structure, the structure of kind of St. Amant's executive team and the board and that all of that reporting structure will not change. Who will oversee all of these changes and ensure the optimal care and status that St. Amant is known for? That's a really great question. So the HTS leadership team, with myself as the director of that team, that is our day-to-day work. That's what we do every day. We're committed to making sure that we provide high quality care. We also have our executive team, and we have our board, as well as our relationship with the Compassion Network to oversee that we are providing that high quality and high standard of care. And we are also linked in with the WRHA. And so we also meet the standards they set and the standards that are set by Accreditation Canada. So still lots of oversight and certainly commitment to making sure our care remains optimal. What happens to the outreach and autism programs? So I believe it's nothing. You know, this change is really, although it applies to St. Amant, it really only impacts H&TS. So it was the H&TS section of St. Amant that was considered developmental center. So all of the other programs, the CRP, you know, our home share, foster, autism, childcare, all those things are remaining functioning and without any significant change. And that was it. That was the last question on that list. So great list of questions there.
I'm not seeing any additional questions in the chat right now, Sarah. So,
okay.
Oh, there's one. I can read it out to you. It's hard to be as confident in the smaller group homes will provide the same level of care for our family member as she receives at St. Amant, with the level of training of staff in those facilities not on par with St. Amant.
Yeah, I can appreciate that concern. You know, there's lots of efforts and lots of discussion within the abilities community around, you know, that exact point. So, you know, all agencies want to provide a high level of care. You know, I think, again, when we start to have conversations about transition and what might be the best location for an individual to be supported, it really does involve a good look at, okay, so what are the care and support needs, and, you know, are they really quite medical? Are they not medical? And I think that will help in assisting kind of finding that ideal location. And then certainly, you know, I know our clinical services team does support other agencies in kind of some training and but yeah, I wish I had a magic wand that everyone could be on par and have the same access to resources and nursing, et cetera. But yeah, thanks for sharing that, Connie. Yeah, I don't know if you had anything to add there, Jen.
Yeah, the only thing I might, like I 100% understand where you're coming from and understand the concern, the training, and the staffing is totally different. The one thing that does bring some comfort is that there's been an ongoing transition research project, and they are closely following the like the health outcomes and the quality of life outcomes from people who have transitioned. And all of that data looks really good. Like there hasn't been significant changes to people's health and safety once they've made a transition. So from that perspective, I hope that can bring a little bit of comfort.
Yeah, thanks for sharing that. And that's active work being done by our by the St. Amant Research Group. And I've had the chance myself to do some deep dives into research from other jurisdictions, specifically Ontario, and the results were the same. So really no change or even an improvement in some health outcomes, and a drastic improvement in quality of life were reported across the board for folks who transition from a congregate or institutional type setting into a community living. And that was regardless of which agency they were supported by.
Yeah, I think too, I mean, let's knock on wood that we don't have a pandemic every day. So I'm not expecting to experience another one in my lifetime. Maybe I'm just optimistic, but if you also compare outcomes from congregate settings during the pandemic to outcomes in community during the pandemic, community by far had less severe cases, spread, death, just because of the nature of the environment. There wasn't the opportunity for that to spread with a smaller group of people. So there's that kind of thing too, when you can relate that to like influenza or other sorts of things that do happen on an annual basis too.
Yeah, I hope the same. Although I start to worry about, like, is this just going to be a pandemic that lasts the rest of my life? Maybe not another one, but maybe this one will linger, but I don't think so. We'll get to the other side of it eventually. Yeah.
Will the reno plans be shared? Like, I'm just curious what's happening with Cedar View. Is it going to be like one big unit where you can have more than one person on there? Just because it seemed like a huge waste of space, because that's where Trey resided when it really was housed. You could have had 8 people there and there was only 1.
Yeah, that's a great question, Tracy. And really, that was one of the primary drivers for this renovation. You know, I think we all know and appreciate how old the building is at 440 River Road. And certainly the design of those spaces did not support kind of some of the safety measures that were required with certain individuals and their needs. So the renovation, so Kate McKay is our senior manager of capital planning, and she's leading this work. And I know she's been working with Jen as well as Todd McDonald and Sheena Brown, who's the manager there, to make sure that updates are shared on a fairly regular basis. So I can't comment on what her plans are for sharing broadly with families and kind of showing pictures and things like that. But I know that they're working on that. So the renovation is focused on kind of Ashview, Birchview, Cedarview. And at the end, those 3 areas will have capacity to support up to 3 individuals in each space. And that would be regardless of kind of what the needs are. So the space is being designed with safety at top of mind, along with making the environments much more pleasing and kind of inviting, lots and lots of natural light, and lots of connections out into the courtyard so people can spend time outside. But yeah, we will not be kind of left with having to support one person in one giant kind of cottage anymore. We'll have the ability to support up to 9 individuals across the three areas that are being renovated. And then Riverside and Mapleside, they'll stay kind of as is, and they'll be able to support up to about 8 to 10 individuals, again, depending on the type of supports that are needed. So we do see a capacity total across the 5 cottages of being about 14 to 17 individuals.
Well, that sounds better.
Yeah, yeah, and
And then
it's,
also the access to the Bueller Garden, like directly from the unit.
you know what, I'd have to follow up with Kate on that. I've seen the drawings. I have to admit, my brain doesn't work in blueprints. I just don't have that type of brain. So we can get back to you with that answer, Tracy.
Okay.
Yeah. The other great thing too is we've been really looking for opportunities where staff and people supported can contribute to the renovation, in the sense of, let's pull together some like design elements, so paint color and flooring and artwork, and really, let's put that out to the people we support and staff to kind of vote and decide, like, what do we want this environment to look like, and what will serve us best.
And Tracy, you've got lots of experience. So if you wanted to have a conversation with Kate, if you have any suggestions or advice, I'm sure like she would be really open and love to hear that. I could set that up.
Well, I was just more curious as to what was going on back there and if it was going to be, shared, the blueprints or whatever, or kind of like future pictures of what it's going to look like when it's all done.
So to be perfectly honest, we have some future pictures that came from I think it's the architect firm, and we were going to use them when we were going to have the ribbon, like the groundbreaking, and they did such a terrible job on them. Like they look really
Yeah,
ugly.
they weren't good.
And they were terrible. And I was like, this isn't inspiring and this isn't what it's going to look like. And so we didn't really want to share them because they don't really look good. And it costs money to get new ones. So we're kind of hoping that we can just take pictures along the way, but I'll get Kate to explain it better. And then we can share that with families, because I think lots of people are curious. So I'm glad you asked that question.
Yeah.
There's another question. Oh, sorry.
Oh, sorry. I was going to say, as of right now, the last photos I saw was like everything's kind of stripped down. So if it was a full reno, like a full demo of the existing space, right down to the studs. They're replacing wiring, heating, HVAC stuff, doing any kind of asbestos abatement as required. And so the space right now, like when you look at a picture or you go into the space, for me, I have a very hard time, like, okay, where am I? What am I looking at? And they'll be like, oh, well, this space is going to be the kitchen and this will be a bedroom. And I'm like, it just looks like space to me. So the photos right now aren't super exciting, but I know that they're going to get much more exciting as more and more work happens.
It also depends who you talk to, because Kate gets really excited about the pictures. So
yeah, she's got that mind.
Yeah,
for sure.
She does. So the question is, are you seeing many of the past residents returning for respite or additional care? Meaning, does the temporary stays include past residents whom the community wasn't a good fit?
Yeah, great question, Val. So in my time so far with the organization, so it'll be 3 years in September, we've had one person who has kind of come back and forth, and not because their community placement is a failure, but really to support their caregiver in some of their medical needs. So it was kind of that, I'm undergoing some surgery, or I have some medical issues and I can't provide the care that I normally provide for my loved one. And so we welcome those folks back. So it's longer than a respite stay, but not a permanent stay. Really, our goal is to find folks a spot that's a really good fit for them. And so no, like we haven't seen people kind of bouncing back, for lack of a better term. But we do offer respite to anyone and everyone who could benefit from it. And so we know respite's a super important part of caring for people with high medical or high behavioral or personal care needs. And we know it's not as simple as kind of booking a babysitter, right? So we want to make sure that respite is available. And so that's another way to support kind of a successful transition is kind of having that option. So for now, we do have respite available for individuals with kind of complex health needs. We're not able to offer respite for people with kind of high behavioral supports. And that's really a product of the environment we have and the space that we have. But that's something that's, could we, right? Is that one of those unknowns that we want to dig into a little bit more, is offering more respite? Yeah, did that answer your question, Val? Yeah, okay. Great question. Okay, well, I'm not seeing anything else right now. I know we're a small group, and you might not have many questions, and that's fine too. So like I said, we're gonna summarize. Oh, here we go. Hi, Tracy. I'm very hesitant. Yeah.
Yeah, you probably all know that.
Yeah. So, again, like a real concern, absolutely. And, I think that our CRP team is very adept at supporting people with behaviors. And there's a lot of effort going into making sure wherever Trey does end up living, it considers all those aspects of his care. So, I don't know if that's going to help your worry as a mom, right? You're going to have those worries for sure as a mom. But the meat and potatoes of transition is having those conversations and making sure that the receiving team really understands, what the care and support needs are. In other situations, we've certainly had staff from other agencies come and spend time with us in HTS. So shadowing our team for sometimes a couple weeks, right? A really good understanding of people's routines, their tendencies. They get the opportunity to meet the people they're supporting and really learn from our team. And then also those conversations about what does the space need to look like? How do we achieve what Trey needs from a safety perspective in the least restrictive way possible? So yeah, and so I would encourage you, to continue to kind of voice those needs and concerns when you have those transition meetings. And we really want the same thing for Trey. We want him to be safe, well supported, and enjoying life in the community. So we want to work together on that, Tracy. Thank you.
I think too, it would be interesting to chat with either a family or a team who supports other people who, have a tendency to run. Because I think we do support some other folks in the community. And so it might be of comfort to hear what kind of plans they have in place and how they are able to manage that safely.
I think there was a question before mine. Connie had a question.
Oh, yeah, there it is. Sorry about that. In the past, it was mentioned that the physio and recreational resources at St. Amant would still be accessible to a client placed in a group home. Is that still the case? Jennifer, do you remember those conversations?
Yeah, so certainly our clinical services are available to anyone who's supported by St. Amant and even people who aren't. So if your family member was to move even with a different agency, you could still put in a referral for clinical services. We did close our day services earlier in the pandemic. And so I think that's the recreational resources that you're referring to. So that program doesn't exist within St. Amant anymore. So that wouldn't be available. But certainly all of our clinical services would be.
Yeah. And then of course the Spirit Cottage and the pool is available to people supported through St. Amant in terms of recreation. It's a pretty nice pool. Yeah. Okay. Well, that takes us to just before 7. So thank you all again for being here tonight. I appreciate, an hour of time. It's a lot for some, so I really appreciate you spending this hour with us. I hope this has given you a better understanding of what this designation change means. And certainly if more questions come up, or if something that was talked about this evening is leaving you with some lingering thoughts, or you want to just chat more about it, please reach out. My contact information is on the website. I'm available via email or phone. So certainly if you have questions, please reach out. And we'll work on kind of summarizing this town hall and making sure that it's shared with other families who weren't able to attend tonight. Thanks, Connie. Okay, so I think we'll say goodbye for tonight. And yeah, I hope you all have a good evening, and it is still light outside. So there's another thing to be grateful for. So if you want to get out for a walk, you could still do so in some daylight. Yeah, agreed, Val. Thumbs up for that. Yeah, I have a white dog, so I'm a little reluctant to take him out right now, but it must be done. It must be done.
You got to put grips on the bottom of your shoes if it's getting cooler out. Mm-hmm.
Yeah. Okay. Well, thank you all so much. Have a really great evening, and I hope to see you